So antiretroviral therapy describes the class of medications that we can give you if you have HIV. And HIV is a virus, and so antiretrovirals really just speaks to drugs that target that specific virus. The HIV viral load describes how much HIV you have in your body. And once HIV enters your body, the only thing the HIV virus wants to do is it wants to replicate as much as it can. What the antiretrovirals will do is that they will target the HIV in your body, and they will decrease the amount of HIV that your body is seeing. Combination antiretrovirals describes the combination of medications that we'll use to treat HIV. So one class are the nucleoside or nucleotide reverse transcriptase inhibitors. Another class is the non-nucleoside or nucleotide reverse transcriptase inhibitors. A third class are protease inhibitors, and a fourth class are integrase inhibitors. But they're new classes of medications that are being developed every day to make sure that we have lots of options of how we treat HIV. And that's because HIV, unfortunately, is a pretty smart virus that if you only introduced it to one drug, it would eventually learn the properties of that drug and mutate against that drug. So the way that we got around it is we actually give an individual usually 3 classes of HIV medication, sometimes it's just 2, to make sure that the virus can't get smart to the combination of drugs that we're using. And in that way, we're able to keep the viral load low in their body. So for recently diagnosed patients, people who've just gotten an HIV diagnosis, there are many reasons to be hopeful. And probably the biggest one is the fact that the world of HIV treatments has expanded tremendously. We used to have a handful of drugs to treat HIV. Now we have so many that if there's any reason that you don't like the regimen that you're on, it's very, very easy to change you to something else. And so I think that those factors really allow people who are being newly diagnosed to feel like this isn't a death sentence, that this is actually something that you can manage, that hopefully you live a normal life just as though you didn't have HIV.